What is the most appropriate response when a resident with dementia becomes agitated during a shower? A. Continue quickly to finish the task. B. Yell at the resident to calm down. C. Stop the shower and try again later. D. Restrain the resident. Answer: C. When a resident becomes agitated, the best response is to stop and try again later. Forcing care increases distress and can lead to aggression. Which of the following is a sign of fecal impaction? A. Bloody urine. B. Frequent small liquid stools. C. Vomiting undigested food. D. Wheezing. Answer: B. Frequent small liquid stools can indicate fecal impaction, as only liquid stool can pass the impacted mass. What is the main reason for keeping the head of the bed elevated when feeding a resident? A. Prevent dehydration. B. Increase appetite. C. Prevent aspiration. D. Improve digestion. Answer: C. Elevating the head reduces the risk of aspiration, where food or fluid enters the lungs, potentially causing pneumonia. If a resident refuses care, the STNA should: A. Force the care if it's essential. B. Document the refusal and notify the nurse. C. Ignore the refusal and return later. D. Scold the resident for being non-compliant. Answer: B. Residents have the right to refuse care. It should be documented, and the nurse should be informed for follow-up. When assisting a resident who uses a cane, where should the STNA position themselves? A. Behind and to the strong side. B. Behind and to the weak side. C. Directly in front of the resident. D. On the resident's strong side. Answer: B. The STNA should walk behind and on the weaker side to offer support in case the resident loses balance. A resident who has just died must be cared for with: A. Disregard since they are no longer alive. B. Urgency to free up the bed. C. Dignity and respect. D. Speed to avoid complaints. Answer: C. Post-mortem care must always be done with dignity and respect, honoring the person even in death. Which of the following tasks is within the STNA's scope of practice? A. Administering medications. B. Diagnosing skin conditions. C. Assisting with oral hygiene. D. Prescribing treatments. Answer: C. STNAs can assist with activities of daily living like oral hygiene but not perform medical treatments or diagnoses. When providing catheter care, what should the STNA clean? A. Only the catheter tubing. B. The meatus and 4 inches of the tubing. C. Only the insertion site. D. All parts of the catheter including the bag. Answer: B. Proper catheter care includes cleaning the meatus and about 4 inches of catheter tubing to prevent infection. Which of the following is a key principle of infection control? A. Avoiding residents with known infections. B. Hand hygiene before and after care. C. Using gloves only when visibly dirty. D. Limiting fluids for infected residents. Answer: B. Hand hygiene is the most effective way to prevent the spread of infection between residents and caregivers. If a resident complains of chest pain, what is the STNA's first response? A. Call the family. B. Help the resident to the bathroom. C. Notify the nurse immediately. D. Give the resident water. Answer: C. Chest pain could indicate a medical emergency such as a heart attack, and the nurse must be alerted immediately. The proper term for difficulty swallowing is: A. Dysphagia. B. Dyspnea. C. Aphasia. D. Hyperglycemia. Answer: A. Dysphagia refers to difficulty swallowing and requires special attention to avoid choking or aspiration. A resident asks you not to tell anyone they fell. What should you do? A. Agree and keep the secret. B. Record it in the chart only. C. Tell another STNA privately. D. Report it to the nurse. Answer: D. All accidents must be reported to the nurse, even if the resident asks you not to. Safety is the top priority. Which of the following is a normal age-related change? A. Increased risk of UTIs. B. Sudden onset of confusion. C. High fever. D. Incontinence due to disease. Answer: A. Older adults naturally have a higher risk of UTIs due to changes in the urinary system, not necessarily linked to infection or fever. When making an occupied bed, the STNA should: A. Tell the resident to get up. B. Keep the side rail down for access. C. Roll the resident to one side. D. Replace the mattress first. Answer: C. When making an occupied bed, roll the resident gently to one side and work on one half of the bed at a time. The best method to prevent falls in a resident with poor balance is to: A. Apply wrist restraints. B. Encourage bed rest. C. Keep frequently used items within reach. D. Let the resident move independently. Answer: C. Keeping items within reach helps reduce unnecessary movement, decreasing the risk of falls. Which of these is a sign of dehydration in an elderly resident? A. Wet skin. B. Slurred speech. C. Confusion and dry mouth. D. Shivering. Answer: C. Confusion, dry mouth, and low urine output are common signs of dehydration, especially in elderly residents. The purpose of reality orientation for confused residents is to: A. Discipline them for memory loss. B. Force them to behave. C. Gently remind them of facts like time and place. D. Increase their anxiety. Answer: C. Reality orientation involves calmly and respectfully reminding residents of time, place, and people to reduce confusion. Which is the most accurate way to measure fluid output? A. Estimate based on conversation. B. Use a graduate container. C. Ask the family. D. Assume from last shift. Answer: B. A graduate container allows for precise measurement of urine output, which is essential for accurate documentation. What is the proper technique to remove dirty gloves? A. Peel both off together. B. Pull off one glove, then use 2 fingers under the other. C. Use a pen to avoid touching. D. Remove by shaking your hands. Answer: B. Remove gloves by pulling one off and sliding 2 fingers under the other to avoid skin contact and contamination. Which document outlines a resident's preferences for medical care if they can't speak for themselves? A. Care plan. B. Incident report. C. Advance directive. D. Progress note. Answer: C. An advance directive provides instructions for healthcare providers on what kind of treatment the resident wishes to receive or refuse.